I like goals that are like, I want to be able to go to my granddaughter's recital without worrying about my blood sugar going up or down. And I want to go to my nephew's sporting events without having to worry about my diabetes. Like that, those are the kinds of goals I like to set with patients, not just, I want my A1C to be less than this number. I don't like to treat numbers. I like to treat patients.
Feeling well. I think that's such a good piece to this, and looking at people's goals, because everybody's is different. Hello, and welcome everybody to the Patient Advocacy Initiative podcast. I'm your host, Dr. Asha. And today we are talking about a topic after my own heart. We're talking about type 2 diabetes and insulin management with type 2 diabetes. I am so excited and honored to have my guest, Dr. Desiree Massari, here. She is a dear friend of mine, and we've been working on her business for quite some time. And we are excited to announce that Massari Wellness is open for business. And she has been a pharmacist for several years, and she's worked in different capacities, but her passion is helping patients manage insulin with type 2 diabetes. And I love her story. So welcome, Dr. Massari. Thank you for being here. I would love to hear your story and just share that with the world, please.
Yeah, of course. Yeah. So like you said, I've been in pharmacy for quite a few years, and I've always chased diabetes, actually since before I was a pharmacist, because my grandfather had type 2 diabetes. And what happened was, right before I left for pharmacy school, he ended up having to go on insulin, like the summer before pharmacy school, and really struggled with it. Had a lot of low blood sugars, a lot of trips to the emergency room because of those low blood sugars, very poor quality of life. And I found out through pharmacy school that he was actually very poorly managed, and that with some education and with some better insulin management, it really would have improved his quality of life. So it's sort of been my mission since becoming a pharmacist to prevent that suffering from others. So that's where Massari Wellness came from.
I love it. And Massari is your family name. So
that's correct. And that was his last name as well. Yeah.
Wonderful, wonderful. I love when we can honor that. That's where PAI Wellness Group came from, is obviously from my maiden name and my family. Mm-hmm. So I love that. So, you said a lot of really great things in there about quality of life. Mm-hmm. And I think there's a lot of fear that a lot of patients have with, especially with type 2 diabetes, with hearing that they might have to get on insulin. Mm-hmm. And so is that something that you address during the conversations with these patients, is the fear that they have?
Oh, for sure. For sure. I think a lot of the fear comes from not knowing what they're getting into and hearing rumors from other people about how, it was like, oh, I know a friend of a friend of a friend went on insulin, and then, they passed shortly after. And you sort of have to just educate them that, yes, in the past, people were started on insulin at the very, very end stage of their disease, where they've already had all these complications, and it's sort of like a last stitch effort. But with new guidelines and things like that, we start on insulin a little earlier to prevent those complications from happening in the first place. And if you have that knowledge, knowledge is power, to sort of like understand your insulin and understand your diabetes. I feel like that helps to alleviate a lot of the fear. And that's what I spend a lot of time doing with clients is helping them understand themselves, their diabetes, and what their goals are.
Love that. So personalization too. It's not, you mentioned the word guidelines, and I think a lot of people think, oh, well, they're just following a guideline. This is why I'm on this and that kind of thing. But it's really about personalizing to them and what their experiences are, what their life is like, right. And being able to help them understand. And I love the knowledge is power phrase, which it is. I mean, a lot of people just don't know. And so that's why we're here. And we're here to.
Yeah, you're afraid of what you don't know. So so I try to help alleviate that fear by giving them the knowledge. And then, to your point, the nice thing about the guidelines for diabetes is that they sort of allow for that quality of life. They sort of say, okay, if this is what your goal is for your patient, this is sort of the path you should follow. And I always say it's about managing your diabetes, so that diabetes isn't managing you, so that you can go to the event. Like, if I like goals that are like, I want to be able to go to my granddaughter's recital without worrying about my blood sugar going up or down. And I want to go to my nephew's sporting events without having to worry about my diabetes. Like that, those are the kinds of goals I like to set with patients, not just, I want my A1C to be less than this number. I don't like to treat numbers. I like to treat patients.
Oh gosh, you just said like 15 things that I want to repeat. So
Yeah.
I'm going to repeat what you said with, you want to help patients manage their diabetes instead of letting their diabetes manage them.
Yeah.
Oh, like I just want to put a big like plaque around that, right?
Yes.
So I think that's so amazing. And then setting goals that are personal to them and not just treating the numbers.
Yes.
And a lot of times what I see, because I work with a lot of type 2 diabetes patients, is yes, people are treating the A1C numbers.
Right.
And so I want you to talk to that a little bit and how you don't just treat the A1C. What do you look at?
So you're also looking at the trends of the blood sugars. So one of the first things I have my patients do is bring me in your blood sugars. And it's not so much, I want to see like if you're in range. It's more like, well, what are we doing this time of day? Are you more stressed this time of day? Are you, do you tend to eat different this time of day? And what changes can we make to keep your quality, but also help manage those numbers? Because diabetes is really about the trends. It's not about one sugar that's above 200, which I do have patients that'll focus like, my sugar was 200. It has to be below 150 or whatever their goal is, because patients have their own goals. It's more like, okay, that was one off. I'm not worried about one. Or I'm worried about like if every day at lunchtime your sugar is 200, then what are we doing at lunchtime? Are you stressed? Because some people don't realize stress increases blood sugar. It's not just necessarily what you eat. There's a lot of things that contribute. So I think that's one of the things that people don't realize, is that it's not about treating that number. It's about treating you so that you feel better. So, and then that'll follow. The numbers going down follows. It's not a matter of just getting that number low, because I can get that number low and tell you to eat a salad. But if you're not going to eat that salad every day for the rest of your life, then that's not going to work for you. So
100%. It's about sustainability.
Exactly.
Sustainability, looking at trends. I love that word too, that you said, the trends of what your blood sugars are doing on a regular basis. So I think a lot of people are not aware what an A1C actually means. And it's an average of the last 3 to 4 months of blood sugars. And so the way I like to describe it is, if you have a really high 200 blood sugar 1 minute, and then you drop low, you get a hypoglycemic episode and you're in the 60s, that average is going to look fairly good.
Great. Yeah, it'll look great.
It'll look great.
You're not feeling so great.
100%. And this is where we need to manage that. And whether it's with prescriptions or your lifestyle, looking at you as a whole person.
Yeah. That's another thing. I like to cut out meds too, which a lot of people think pharmacists, they want to put me on meds. I'd prefer you be on none, to be honest. But yeah, a lot of things, like sometimes medications affect. That's why it's okay. Take a look at the whole medication list too, because medications can affect stress levels, can affect, blood sugar. Maybe you're taking something the wrong time of day. It can all be related. So that's why it's important to treat the whole patient, not just a number too.
Well, I'm going to segue that into that you call yourself the Wellness Pharmacist. And I think that's a fantastic term, because it is true. The misnomer is that pharmacists want to put you on meds. And in fact, a lot of us are hitting the trend of not being that way. We actually want to see less and less meds, but we do realize that there is a reason and a necessity from time to time to be on prescription.
Exactly. Yeah.
And so can you tell me why you chose Wellness Pharmacist? What does that mean to you?
So to me, I didn't want to be just a clinical pharmacist or something like that. I want to be a wellness pharmacist, because I want to look at the whole picture, not just, hey, I want my blood sugar under control so my kidneys aren't damaged. I want my blood sugar under control so that I can enjoy time with my family, and I can enjoy, activities. I can go exercise without doing something I enjoy without having to worry about my sugar going too low. So I sort of take that holistic approach where it's not just your diabetes, it's your wellness. I think we've talked about before, like diabetes is a component of you. It's not you as a person. And I want to treat the person, not just, diabetes.
Yep. Yep. It's a piece of the puzzle. It's not the
Exactly.
whole thing.
Yes,
Yes.
a piece of the puzzle. That's a perfect
Yes,
way to put
I
it.
love it. No, that's so wonderful. And I struggle with that because a lot of times people come to me as well, and I'm sure you see the same thing, that they're just looking at that one piece and saying, okay, fix my diabetes.
Exactly. And I'm like, whoa, wait a second.
Oh yeah,
What are goals? Why do you want to fix your diabetes? Like, if you just want to fix your diabetes to like, because you want an A on your paper, that's not the same thing as wanting to feel well. So.
Right. So feeling well, I think that's such a good piece to this, and looking at people's goals, because everybody's is different. So that personalization piece that you're talking about is so important. And I feel like a lot of times in healthcare right now, as it stands, that people feel like a number. They just feel like another number, and oh yeah, I am my disease, or I am diabetes, right? And it's not that you are; it's that you have it, and it is something that we can manage together, right?
Yeah, and I'm try to be very careful about wording ways that patients with diabetes, not a diabetic patient, because that's sort of the trend for a lot of different disease states. But in the diabetes world, you're not a diabetic; you're a patient with diabetes, or a person with diabetes. So
absolutely, I love that. So kind of reframing that and rephrasing that for
exactly
for everybody else, but also for yourself, to
your
not feel like
is person, human, whatever you want to be, grandma, grandpa, mom, dad. That's who you are. Diabetes isn't who you are. So I like to set goals around that, about what your true descriptor is, not about the diabetes.
Love it. I'm going to go back to the fear for a second, because we did talk a second about that at the beginning. And I think the fear is, again, in the past, patients were held off on being put on insulin till much later. And so they were already experiencing complications. And so typically when people passed, it was because of the complications of uncontrolled diabetes.
Correct. Yes.
Right. Okay. So patients are being put on insulin much sooner. And can you describe that one more time? Why are they being put on it much sooner?
Yeah. So basically the goal is to not play catch up. So in the past, there was a lot of what's called sliding scale insulin, where you would say, oh, sugar's 250, give a couple units of insulin. Well, it makes your sugars go up and down and up and down and up and down. And yes, A1C might look great, but what's happening is you're up and down, up and down, up and down. And so now we sort of try to get ahead of it. And the goal is to get ahead of those sugars so that you're at a steady rate and without those ups and downs, which those are what affect your quality of life. Those are what cause complications. It's not just the high highs. The high highs oscillating with the low lows is what causes those complications, because your body's like, what's going on? So I like to show my patients, if they're visual learners, I like graphs, like this is what your insulin's supposed to do. This is what your insulin's doing right now. And this is how the insulin is getting ahead. That's why you give your insulin before a meal, not after, because you want to get ahead of that to make your insulin as normal as possible. And so that's sort of what I try to educate patients on. We're trying to prevent, basically. It's not playing a catch-up game. And that's why we started earlier, because if your A1C is already 10 at diagnosis, we don't want it to stay at 10. We want it to go down, and insulin is the fastest way to do that. And I think to that point too, type 2 diabetes, it's not necessarily a life sentence with insulin either. And I think that's important for patients to know as well. Because we're starting it earlier and we can get things under control. You give your pancreas a little break, and sometimes the insulin can regenerate if the damage isn't too far gone. But it doesn't have to be so scary.
Yeah, no, I love how you described that. That was a beautiful explanation. I think, yes, it doesn't have to be a life sentence. And there are other things that we're doing in addition to bringing this insulin on. So we don't have to start at massive doses of insulin.
Exactly. Yeah, you definitely want to start low and go slow, especially because by the time you're on insulin, usually patients are, in their older years, because they've had diabetes for a while, with the exceptions of some who, are diagnosed young with high A1Cs or something like that. Most of them have had diabetes for a while. And you're older, and you want to avoid those long-term complications, but you also don't want to overdo the insulin and cause low blood sugars. Because a lot of people don't realize, they think, oh, I don't want high. I don't want high. What you really don't want is low, because high is a sustained high at a sustained like period of time, whereas lows will affect you almost immediately. So, and that's a common misnomer too, is that, oh, I'm super worried about a sugar of 250. When you're starting insulin, I'm not so worried about that 250. That'll come down eventually. I'm worried about 60s and below. I don't want that to happen. So we start real low, go slow, so that you sort of, and then get to know you, because every patient's individual. So somebody might be able to tolerate 10 units of insulin up front. Some people might only be able to tolerate 2. You have to really, there's a lot of math involved, which I'm a math, I don't know.
Math lover. You're a math
lover. Yes. I love math. I've always loved math. It makes sense to me. It's logical. And so insulin is like a math puzzle. Like it's a math puzzle to me. It's like one of those word problems. So, and every patient's different. So I can do the math to figure out, okay, 1 unit of insulin is going to lower your sugar by this much. And we can work with you to bring back to your doctor, like, hey, this is what I've noticed. And that sort of gives you a voice at the doctor's office as well. Like, because now my patients understand, and they can have a fruitful conversation with their doctor.
I love that. So the premise behind the patient advocacy initiative is all about that. It's about giving patients the knowledge and education and power to be able to have those fruitful conversations with their healthcare team.
Yeah, because sometimes you only see them for 15 minutes. So I'll spend a couple hours with you. You'll understand it so that you'll know in those 15 minutes what you need to get accomplished and what questions you need to ask and what you want to advocate for yourself for.
100%. I love it. Love it. Love it. So with that, I am going to, we could sit here all day long and talk.
Oh, for sure.
I could. I would love to have you back on the show.
Definitely.
To dive a little deeper, maybe into what insulin and how we can manage that a little bit better. This was definitely just an overview, but I would love to have you back. So I would love to end the show right now with just saying thank you for being here. Do you have any last minute comments for patients that are listening and maybe are a little hesitant on getting on insulin, and how getting some guidance and support might really be helpful?
Yeah, I think is seek help, ask for help. Even if it's your local pharmacist is a great resource. Any pharmacist. I think if you're not sure, ask for help. If you don't have the knowledge, ask for help. And, I'm happy to help, Massari Wellness. You can always reach out to me. But yeah, I think asking for help, even if it's like a second person in the room with you to listen, so that, you can really take control of your own health.
Awesome. Wonderful. Well, with that, I would love for them to connect with you. So if you can give them your website and a link or something, or your email, and then we'll put all of that information into the show notes as well.
Yeah, you can visit me at www.massariwellness.com. Massari is Massari.
Fantastic. Thank you so much. Yeah. Thank you so much for being here, Dr. Desiree. I appreciate you. And we'll talk to you soon.